While constructing a house, do you build it on a swamp, or do you wish to have a firm foundation so that you can enjoy the fruits of a lovely house for many years to come? The same is the case with management of hair loss. You have to build your strategy on a firm foundation. Being casual in taking medication, not being compliant to medical advice in your best interests is going to lead to a shaky building. It will not serve your long-term goals and objectives, and you will not be able to sustain, maintain, and retain your hair for a longer period of time. So this talk is all about strategizing your hair loss treatment. So if you're not getting the result you expected from Finasteride, but are getting all the wrong side effects instead, this video is made for you. There are ample instances of people who use very low dose Finasteride but are able to handle their hair loss better than those who take the full dose. So there is a strategy you need to follow when taking Finasteride. Now, what is the strategy? We are going to talk in this video. Today, a patient asked me whether I was prepared to give a written guarantee that he would not have a side effect to Finasteride. I'm not saying for a moment that all these stories about Finasteride are fake. All of them are not. Nor am I saying that this is due to competing manufacturers of various medications for hair loss. No, I'm not. I'm also not saying that this erectile dysfunction that you see after taking Finasteride is because of pre-existing erectile dysfunction in the age group 25 to 35, which is as high as 40%. No, I'm not saying that either. But will anybody explain to me that though we talk so much about the side effects of Finasteride, and as it is put out on social media, they are a dime to a dozen, why does nobody talk about the side effects of Dutasteride? Dutasteride is a much more potent DHT blocker. It blocks up to 94% of DHT. Do we not talk about Dutasteride because it is an off-label drug for hair loss? Now this gets at my goat. For there is no monetary motivation in suing the company when you're taking a drug for its off-label use for hair loss treatment. I hope you get the point. So there is no end to this controversy. So let's not delve in this too much, and let's go straight to the point about the 5 ways in which you can have better compliance at a lower dosage with lesser chances of side effects. So number 1 is case selection. This is the most important way to sieve out the patients who will have problems with Finasteride, either physical or psychological. So I do a deep counseling. I talk to the patient at length to bring out certain psychological disorders like obsessive compulsive disorder, body dysmorphia syndrome, and the patient having irrational goals and objectives. I also tend to not prescribe Finasteride in those with a BMI, basal metabolic index, of more than 30, especially those who live a sedentary lifestyle, those who are smokers, those who are uncontrolled diabetics, and others with depression and anxiety disorders. In the last video, if you have seen, I have discussed the various personality types and the response to treatment with Finasteride, and how to deal with each personality I have dealt with in greater detail in my previous video. So the second important factor in strategizing the use of Finasteride is customized dosing. The body is not the same from person to person. Your metabolism of drugs varies significantly. How you respond to the drug is also determined by your psychological bent of mind. So all these factors have to be taken into consideration. And in hair loss, therefore, I start with a low dose. In some patients whom I think their personality is labile and they are extremely fearful, I would be a little cautious in exposing them to Finasteride larger doses. So I start in these cases with 0.5 milligram Finasteride taken on alternate days, and then I review this dose regime after 3 months are over. The patient himself will tell me whether he has responded or not, and also by serial pictures taken every week under the same lighting conditions, same time of the day, we'll be able to assess whether he has had significant improvement with Finasteride 0.5 milligram taken on alternate days or not. If the patient does not have any side effect, which mostly is psychological when it happens, I will scale up this dose to 1 milligram on alternate days. That is, if he did not have the effect, the result from finasteride that we were expecting. Otherwise, I would leave it at that 0.5 milligram on alternate days for a longer period of time. Many times a patient reports little breast tenderness or pain in the testicles within 2 to 3 weeks of starting this dose, and he is advised to continue it for 4 weeks. Many times these small issues get resolved and the patient gets over these initial hiccups. In some patients, I have seen that after 2 to 3 years or sometimes 4 or 5 years, the effect of finasteride begins to wane. In these cases, I expose them to once a week Dutasteride 0.5 milligram in place of their that day's dose of finasteride. Now mind you, this treatment that I advocate, customized dosing, is only applicable to hair loss treatment. When you come for a hair transplant, be prepared to take the full dosage, that is 1 milligram a day, for 6 months. And if you think you're fearful that you will have side effects, it is better to do a trial dose for 1 month before opting for a hair transplant, especially if you are young, 25, with extensive baldness or developing extensive baldness. For in these cases, if you are not amenable to take finasteride, you should think twice before getting a hair transplant done, because it will not be in your best interest. It may be in the best interest of a treating surgeon, but definitely not yours. And the third strategy that I use is my switch off, switch on technique. After being on finasteride for 3 months regularly, I advise my patients to switch off, that is, go off finasteride for 15 days. So this fortnight of finasteride helps in flushing out the built up body levels, tissue levels of finasteride. This prevents the patient from falling prey to long-term side effects, that is, late onset side effects. And in those who feel that there is little puffiness of the breast or little pain in the testicles, I would ask them to be off this drug for about 30 days. So this switch off, switch on technique helps us in preventing late onset side effects. This helps us in gaining the trust of the patient and better compliance, especially in patients who are young and have to take this drug long term. The fourth strategy that I use is making the two peaks coincide. Testosterone surge happens due to the circadian rhythm at around 7 to 8 a.m. in the morning in those who have a regular sleeping cycle. Now, if you don't have a regular sleeping cycle, like for example in international pilots, we are not talking about them. We are talking about regular people, normal people who sleep at a given time and wake up regularly at a fixed time in the morning. So in these people, the testosterone surge happens around 7 o'clock or 8 o'clock in the morning. So we have to strategize that the blood concentration of finasteride should also peak at this time so as to benefit from lower doses of finasteride to control that surge in testosterone levels in the body. So this is the reason why people with even 0.5 milligram taken on alternate days respond well as far as the hair loss is concerned, vis-a-vis those who take 1 milligram a day but still do not have an effect of finasteride, may have side effects rather. So making these two peaks coincide is crucial in controlling the dosage of finasteride, maximizing the result of finasteride on hair loss, and preventing side effects. And lastly, what people have not talked about much is the weekend boost in testosterone levels. Weekends are usually a harbinger of peak testosterone levels. It is during the weekend that we engage in severe strenuous exercises like long distance cycling, like running, hiking, and so many others. So this is the time that physical activity increases your testosterone levels, and we need to keep this surge in mind and protect our follicles from the sudden surge of testosterone due to physical activity. Many dosage regimes do not cover this period, and that is their pitfall. In many patients, I have advised them to increase the dose of finasteride to 1 milligram on weekends, or take doses of 0.5 milligram on Saturday as well as on Sunday. So these are the unique strategies that I propounded after treating so many patients over the years, and I have seen that they have been more or less beneficial to a vast majority of my clients. And that is why I made this video, so that you should be aware that with minimal doses of finasteride, you can get maximum benefit and lowest incidence of side effects. So knowledge about the drug that you're taking is crucial. How to strategize, take the maximum benefit from the drug is equally important. A low dose of finasteride taken intelligently is more beneficial than a high dosage taken casually. So with this regime, I am proud to say that in my experience of about 15 years managing hair loss, the percentage of people with side effects that I see is less than 0.1% against the quoted figure of 0.5%. So I will advise you to not take your hair loss casually. Take finasteride, not in very high doses, take it intelligently, know everything about your drug, and keep your doctor in confidence and follow his advice. His advice is given in your best interest. So thank you for watching again, and if you have any questions, any information you seek that comes to your mind, do not hesitate. Just drop a comment below and I'll be there to answer to your each and every query. Thank you for watching, and God bless you.